Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and I'm here for another one of my live Q&As that I have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and your chance to ask questions. So if you guys have any questions, please feel free to put them into the chat. Please remember we're on Facebook and Instagram for additional content, and please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator and allows me to be a part of the YouTube health platform. And remember, share the channel with your friends and family and ask them also to like and subscribe. So we have a few questions today, and I'm definitely going to get them started, but I see we have some questions already into the chat. So, and these were actually really good. So hi, Movie Mode. Welcome back. So the questions are, can vitiligo develop after a pregnancy? Also, can the discharge from a yeast infection burn or cause a discolored or vitiligo look during or after pregnancy? And if it is vitiligo, what vitamins treat this? So this is a really great set of questions because this is actually a condition that affects a lot of people. So vitiligo is basically where parts of the skin are discolored. And so usually you have lighter parts and darker parts to the skin. And they really can be caused by a variety of reasons. But basically, those pieces of the skin that get lighter, they have issues with the melanocytes or the melanin that's in there. And melanin is what gives us our darker color. And so there are a lot of different thoughts with vitiligo and what the causes are and stuff. But what we do know is that it can be triggered by stressful events. It can be triggered by skin damage, and it can be triggered by hormonal changes to the body. And if you think about childbirth, a lot of that happens, especially stressful. Childbirth is stressful, even if you have a wonderful experience, because it is a huge shift for your body. Your body, in the matter of a couple hours, is going through a lot of changes. So this is absolutely something that they've noticed that you can be triggered, and that can be the start of having vitiligo. The mechanism is not completely understood, but it does seem to happen after pregnancy and the birth of a baby. Now, the discharge from a yeast infection, it can absolutely burn. But I don't think it can cause the discoloration or the vitiligo look. But honestly, I don't know that one. It doesn't really make a lot of sense to me. So I'm going to say I think it's a no, but I really am not sure. Now, unfortunately, with vitiligo, there's not a lot of options for treatment yet. They're still working on a lot of it. But as far as vitamins go, it's still being studied. So there's limited data on what's actually effective. There are some studies that show some potential possibles. Like ginkgo biloba is one that may help. There's other studies that show alpha lipoic acid, folic acid, vitamin C, and B12 may also help with the treatment of this condition. However, these are very small studies that are being done right now. And so a lot more work is needed to actually find out if that is the case. And then there are some studies looking into phototherapy to help restore some of the color. But again, all of this is in the early stages because it's just, this is a condition that's very complicated. If you're not quite sure what the cause is, it's very hard to figure out how to fix. But they are, looking into some of this stuff actively, and, hopefully we'll get some answers. So I hope that answered your question. That was a very good set of questions, and that's a very common condition. So, that was a good one. Any of you guys who have any questions, please feel free to put them into the chat. I'm going to start out with a question we got on the TDAP vaccine video, and it said, I got the tetanus, diphtheria, toxoids in 2019. I'm now 28 weeks pregnant with my first child. Do I need a booster? So this is a great way to start us off. So, when you're pregnant, you are considered immunocompromised. Your immune system has to calm down so that it doesn't look at the baby as like a foreign invader and attack it. So your immune system's kind of tanked. And if you have friends and family who've been pregnant, you will find if you pay attention, they're always sick. Pregnant moms always sick. And the thing is, what stinks about it is you can't take any of the over the counter medications. There are not a lot of options for you to take as far as like some of the steroids and stuff that we use. We try not to use those unless we have to. So you're kind of stuck just like using chicken soup and nasal spray and just trying to hope for the best. So one of the reasons why the TDAP vaccine is very important is that it is helping to provide antibodies. So we do flu and COVID because that protects mom. And the reason why it's protecting mom is because you develop antibodies, which protects you from getting serious disease. When we do the TDAP vaccine, your body's producing antibodies. But the unique thing is it is doing two things. It is protecting you from getting tetanus, diphtheria, and pertussis. But you can also transfer some passive immunity to the baby. Now, it won't last for long, but you can pass it to the baby. So pertussis is whooping cough. And this is a illness that is endemic in many parts of the world. I'm from South Florida, and we actually have it here in Miami-Dade. And there have been babies that have passed away from this. So for an adult, when you get whooping cough, pertussis, as an infection, right? If you get whooping cough, you can walk around and not even have symptoms. You don't necessarily have to have a cough to have whooping cough. And you can be very, very mildly ill, like super mild. So the thing is, we don't necessarily know as adults that we have it. But for children and babies, their illness is far more severe. They do actually develop a cough. It leads to a lot of respiratory issues. And unfortunately, it can lead to death. So that's why it's so important to get the TDAP vaccine. That's why it's recommended for all moms. So the Centers for Disease Control recommends that you get the TDAP vaccine every single pregnancy early in the third trimester. And this is okay, even if you've had a baby 1 year ago, they're still recommending that you do that again every year. And it's because there are some serious implications if you don't actually have like that protection, right? Okay. So, one of the other things that's very important for you guys to know is that we are recommending, and we usually recommend that other caregivers get the TDAP vaccine. So most of your healthcare providers that are taking care of you will actually receive the TDAP vaccine. I got the TDAP vaccine for years. I continue to get it, even though I'm not always in the hospital, but I got it to protect myself for my patients. I made sure that I wasn't going to bring pertussis into the hospital and potentially give it to a patient. So that's why we usually recommend partners get it, any caregivers get it, anybody who's going to spend a significant amount of time around the baby. A lot of people say, where can I get it? So at least here in the US, there's tons of different urgent care centers like MD Nows, CVS's have minute clinics, like all these different places that you can go. Most of them, if you go to them, they'll actually have a cash price to get a TDAP vaccine. You can just walk up. How much is it to get a TDAP vaccine? They have a standard price. You can just get it. So it is something that I would tell you is something that you should look into, but it's definitely something you should get every pregnancy. Hi, I see videos. Hi, Ramante. I see videos from time to time where women talk about using primrose oil caps, poking a hole in them and putting them up in your lady parts, up in your vagina for a night for a couple weeks coming up to delivery, saying that this helps with tearing and easier delivery. How true can this be? And do doctors actually approve it? I love that. Okay, so evening primrose oil is a vitamin or supplement that has been around for a long time. And it is used for a variety of reasons. And one of the things is that you should know up front is that it is not studied. There are no controlled studies on this. One of the things that we also say with a whole bunch of these supplements, like the vitamins and supplements that you see over the counter, they're not FDA regulated. They're not FDA studied. So that means that the ingredients that are going into them, you can't tell for sure if they're quality. You don't even know if there's extra ingredients. I have to say that up front. However, I'm a big proponent of natural remedies. I love them and I think they're awesome. So, evening primrose oil is something that's talked about a lot. And what is usually advised is when you get those capsules, you do exactly what you described. You put a hole in it so that the gel part that's inside comes out. And then when you put it inside, it actually serves to kind of like ripen the cervix and get it ready for labor. Now, it can, in some cases, actually start contractions. It just depends on the person and how they're doing it. Some of your healthcare providers will actually give you directions on how to actually like use your fingers and actually apply it to your cervix, because you guys can actually feel your cervix. Don't do that if you're pregnant, because you need to keep your vagina clean, but they'll tell you how to do it with clean technique. So you can actually put it up in there. Now, this is not something that's recommended before 38 weeks. It's not recommended if your water's broken. It's not recommended if you've had any kind of bleeding. So there's a lot of reasons why we don't do it. I will tell you that if you have a midwife taking care of you, you are far more likely to have them recommend evening primrose oil to you. That is something that midwives tend to be a lot more open to and cool with. If you have a standard OBGYN, it doesn't mean they won't recommend it. I know a couple that do, but it really just depends. So, is it true? There seems to be a lot of anecdotal evidence, stories from people that say that it's true. The problem is it's being used right at the end of pregnancy. So is it really that? Is it something else? Who knows? But yes, I do see it. Yes, I know a lot of healthcare providers that feel it's very effective, and it's got some anecdotal evidence from a couple hundred years, really. Ovarian cyst, 3.5 centimeters during pregnancy. Hi, Jafar. So, yes, a lot of people develop ovarian cysts during pregnancy, or an ovarian cyst gets bigger. And that is something that is very common. Sometimes the hormones for pregnancy will actually cause them to get bigger. It just, as far as ovarian cyst, whether it's safe or not for pregnancy, there's no reason for ovarian cyst to be a problem for your pregnancy. So it just depends on a little bit more stuff. Now, I've had one patient recently who she had a particular ovarian cyst that was very responsive to estrogen. And so she ended up having to have surgery when she was about 4 months pregnant to actually remove the ovarian cyst, because it had gotten so large. They wanted to make sure it wasn't cancerous, which thank God it wasn't. So every once in a while, you're actually going to have something like that happen, but it's very, very rare. Ovarian cysts are common with people who have polycystic ovarian syndrome. So polycystic ovarian syndrome, one of its hallmarks is developing cysts on the ovaries. And the biggest thing I can tell you is that if anything, it might cause you to have some extra pain, but there really shouldn't be any contraindication. And if any of you guys want to check it out, I do have a video on polycystic ovarian syndrome. And Jafar, if I didn't quite answer your question, feel free to elaborate more in the chat. So I had a question on my breast yeast infection. One of the things I love is that I get a lot of people on the channel who aren't pregnant yet. They're looking to get pregnant and stuff like that. So I get questions that way. So I got a question from a young girl. I'm 21 years old. I don't have a baby, but I've been facing this issue for the past month. What can I do? So she is referring to a breast yeast infection. So yeast infections of the breast can present with shiny skin on the areola and the nipple. You can have sharp, deep stabbing pains. There can be burning and itching involved with it. So there's a lot of things that can happen. If you have a breast yeast infection, it's treated with antifungals. There's a variety of different antifungals they might use, including stuff like diflucan. They might try topical stuff. It just depends on your presentation. So when you have a true breast yeast infection, you need to get it treated with some kind of antifungal medication. Now, this is where I feel very strongly to kind of let you guys know something. If you're having any issues with your breasts, you need to go to a breast cancer specialist, okay? And it sounds very scary, but really, honestly, they're also called breast specialists because that's like the only people who deal solely with breasts, right? So we have now started to realize that breast cancer is on the rise, and it's really growing at astronomical rates, and they're seeing it in younger and younger women. And if you are of Asian descent, there seems to be a rapid increase, especially in your racial demographic. And so with breast cancer on the rise, and with there being like so many different types of breast cancer being identified, when you're having any issues with the breast, it's important for you to go get it checked out by the specialist. So if you go to your primary or your OBGYN, they might order an ultrasound, which is cool. That's kind of the starting point. But the thing is, when you just get an ultrasound at the hospital or just at some regular outpatient center that does that, the person who's reading that ultrasound is a radiologist. Now, radiologists are trained to look at these images, but they're a radiologist who looks at the entire body, all ages, all the time. So they are looking at so many different images that small changes may or may not be missed by them. And it's not because they're not doing a good job. They are. But just imagine if you're looking at a billion different things all the time, it would be hard potentially to notice a tiny little thing. But a breast cancer specialist, they often do their own ultrasound during your appointment. They will actually do the ultrasound. They look at breasts all the time. That's their only thing. So they are often able to identify really tiny early things that somebody else might not identify. When I have women who are postpartum and breastfeeding and they get what they think is a plugged duct, but they can't get it to release. And releasing means that you take that plugged duct full of breast milk and you get it to like soften up and basically not become the hard knot that it is. If they can't get it released, or if they have symptoms that just continue, I send them to a breast cancer specialist. I do it all the time. That's what I tell them to do. Do not pass go. This is where you need to be, because especially if you're lactating, you have a whole bunch of what look like tumors in your breasts. And so you need somebody who's got the expertise to be able to see what a duct full of milk looks like versus a cyst or mass that needs to be treated. So for this young lady, definitely go to your OBGYN. You want to have them look at it. You're probably going to need an antifungal. And then, you may have to, move on from there. Any of you guys who have any questions, please feel free to put them into the chat. So the last one that I have is I got a comment on my C-section video. And I put out a lot of C-section videos because I don't think there's enough information out there. Because everybody talks about a natural birth as being a birth. So C-sections get left on the wayside. And I think it's really important because they are very scary. They can come up all of a sudden because all of a sudden you might need one. And so there's a lot of things that people don't know. So that's why I have some of those videos out. And so the person commented, I'm wondering if it's necessary to be 2 centimeters dilated before a C-section surgery. I was curious why the team of doctors made me go through such torment when it was certain I was going to have a C-section. Maybe there's a reason for this. I just felt bad because other friends went in for C-section surgery without experiencing contractions. So this was a great question. And so I think it highlights a couple different things. So let's start with kind of the end of her comment where she said that some of her friends were able to get C-sections without having contractions. So that is probably a planned C-section. And let me tell you something. if you have to have a C-section, I think planned C-sections are amazing. They're so easy. It's like you can get all your ducks lined up in a row. You know exactly when you're going in. Everybody's ready for you. I always recommend that if you guys are going to have a planned C-section, ask for it to be on a Monday or a Tuesday. Tuesday is the best day ever. And the reason for that is everybody's back from the weekend, but it's not close to the next weekend. So you've got all the managers, all the anesthesiologists, all the people, right? You get to plan it for the day. And then everybody knows you up front. They have the staff waiting for you, right? Because they know you're coming in. And then lactation consultants and other specialists like that are usually in the hospital Monday through Friday. So if you come in on a Tuesday, you're definitely going to get all the support from those staff too. So I think Tuesday C-sections are like the best ones ever. So if you are having a planned C-section, they're not going to try to have you go into labor. There's no reason to do that. They'll just schedule a date. They'll make sure you're 39 weeks, and then you just go in and you have your surgery. Now, sometimes you come into the hospital not knowing you're going to have a C-section, right? And so you come in and you're in labor. And maybe we do an exam and the exam shows that the baby is breech. Breech is when the booty is coming out instead of the head. It's booty first instead of head first, right? So breech babies, we really try to deliver via C-section. I know you can have some vaginally, but I've personally seen some really, really bad deliveries that way. So I really think C-sections are the way to go. So you go ahead and they tell you you're going to need a C-section, right? And so in order to have a C-section, of course, there needs to be an operating room open. There needs to be an operating team available to help you with your birth. And then you need anesthesia. So you need a spinal or an epidural to give you the anesthesia so that you're not feeling that surgery. So unfortunately, labor and delivery units are very unique in how they work for anesthesia. So in the rest of the hospital, when you're talking about anesthesia, there's basically a whole team of people. And that whole team of I say people, I should clarify, a whole team of anesthesiologists, okay? And that whole team covers the whole hospital. Yes, they'll get assignments. There are operating rooms that are being opened and closed. They definitely shift around, but ultimately everybody does everything. So they cover all of it, except labor and delivery. So labor and delivery usually gets its own anesthesia team. And so they are separate. They're like a little bubble compared to the rest of the hospital. And in very major emergencies, they will bring in the other anesthesiologists because they know how to do what we're doing. It's still just anesthesia and it's still epidurals and spinals. It's done by everybody. But most of the time, the anesthesiologists that are in labor and delivery, that is all they'll be doing. They will not do anything else and nobody will come in. So if you've come in and you are contracting and you need to have a C-section, you need to have a spinal or an epidural. And if they don't have an anesthesiologist available to put in your spinal, then you're going to potentially be waiting and contracting. And this happens to women who are having vaginal births as well. A lot of times they'll be laboring and they're starting to get more and more pain. And eventually they're like, I want an epidural. And then sometimes they have to wait 2-3 hours. And it sucks because that's a really long time to wait for anesthesia when you've asked for it. The thing is, unfortunately, with these small amounts of anesthesia teams, you also have to wait if there's like an emergency C-section. So I think that what happened in this case was that it wasn't that they were forcing you to wait. It's that there probably wasn't an anesthesia team available to give you the anesthesia. So that's my answer for that. So any of you guys who have any questions, please put them into the chat. Because if you guys don't have questions, I am going to be going early, but I'm going to tell you why. So I am currently in South Florida for any of you guys who are coming in from any other places. And we currently have a huge giant hurricane called Milton, who is about to hit us in the next couple of days. And so one of the things we have to do is we have to get ready for that. And so, one of the things I thought I would tell you guys is that if you guys are expecting any children or you have small babies, it's really important in the scheme of all the different natural disasters. We see weather events all the time, that you actually have a go bag ready to go that's ready with your infant stuff, because you never know when you're going to need that kind of thing. So always make sure you guys have some of the extra supplies you need on hand in case you need it because you lose the power or some other event comes up. So, okay, Ramonte, when should you start collecting colostrum? Does it have any impact on when you will go into labor? Love this question. I like your questions tonight. Okay, so if you have any colostrum leaking at all, you can collect it right away. So some women will start leaking colostrum at like 26, 27, 28 weeks, which is awesome. If you have that, you can collect it. If you can get, and if you go onto like Amazon and stuff, you can get these little tiny collection tubes that you can put your colostrum in. So if you can get any of it out, even a milliliter, we'll use that milliliter in the hospital to feed your baby. Because if nothing else, we can take it and we can rub it on their gums, and the baby will start to absorb the sugars from that colostrum just from rubbing it on their gums. So you can collect it if it's naturally coming out as soon as you can. So as far as does it impact when you will go into labor? So this is where it gets tricky. Yes, it can impact when you go into labor. So the milk ejection hormone, the hormone that says release milk out of the breast, is oxytocin. Oxytocin is also the love hormone, and it is also the hormone that causes contractions. The synthetic version is what you guys all hear about. It's Pitocin. Pitocin is the synthetic version, the man-made version of oxytocin, the natural hormone we have in our body. And so when you stimulate the breasts, you can actually cause your oxytocin levels to start to increase, and it can actually cause contractions. Now, there have been some studies done in the world about utilizing this kind of natural reflex to help get you ready for labor. So there were studies that were done, and what they were recommending was you pump one time a day in the 37th week for 10 minutes. And if you could do it on an exercise ball, that was awesome. And any colostrum that you had, you collected for the baby. So one time a week during 37th week. Then in the 38th week, 2 times a day for 10 minutes doing the same thing. And then in the 39th week, 3 times a day for 10 minutes. Now, you cannot do that without talking to your healthcare provider and making sure it's okay for you, because I don't know your individual pregnancy. But going back to this, when they looked at this, what would happen with the pumping is that indeed it did kind of get the oxytocin going. A lot of people would have some contractions. If you're sitting on an exercise ball, it actually opens up your pelvis, so it makes it easier for the baby to kind of slip into the pelvis and put some pressure on the cervix, which helps get it ready. But those contractions were also helping to ripen cervixes. Cervixes, yes. And so what they found when they looked at the data was the people that were doing this stuff were actually having a lower rate of C-sections. And the thought process is it's because their cervix was ready or more ready to have a baby or go through an induction. And so it just created a better scenario for them. Now, as far as collecting colostrum, okay. So when you collect any kind of breast milk or colostrum, you have to do it exactly the right way or the hospital won't use it. Now, you can use it when your baby comes home. So just so you know, any that you have, you can yourself. But if you want to be able to use it for your baby in the hospital, you need to make sure it's collected properly. So what do I mean by collected properly? First thing is you need to have containers for it. You need to have some kind of reasonable collection device. The second thing is, and this can be kind of annoying, but every single time colostrum, it has to be in a separate container. So if I collect colostrum at 1 o'clock and at 4 o'clock on the same day, two separate containers. Now, if you have colostrum from both breasts at 1 o'clock, you can collect those both breasts in one container. When you're done collecting that colostrum, it has to be labeled. You have to have your name on it, and you also have to have the date and time that you collected the colostrum. Again, if you do not have this stuff, the hospital will not use it. They will not allow you to use it because they're trying to make sure everything is done very clean and sterile and all that stuff. So I have seen people have to throw out colostrum, which sucks because they didn't label it. They had gotten to the hospital. They were going to stay with their baby. These are usually NICU babies. And now all the colostrum defrosts and you have to throw it away. So just make sure it's labeled carefully. And you need to make sure it's labeled onto the container. So these little kind of collection tubes that I'm talking about that I've seen on Amazon. And just so you guys know, the collection tubes don't have to be sterile themselves. In fact, if you have a baby in like the neonatal intensive care unit and you're pumping for that baby, they'll give you bottles to pump into. They're not sterile. They're just clean. Okay. So these little tiny things, you look at it and you're like, how in the world do I even put a label on this? So you might have to get creative. You might have to get stickies that go around and then can kind of connect together, figure out what you can do, but it has to have name and date and time. Now, after that, colostrum needs to be put directly into the freezer. Unless you know you're going straight to the hospital to use it or something like that, you need to have it put into the freezer because breast milk and colostrum is only good for 24 to 48 hours in the refrigerator. So it needs to go straight into the freezer. If you tell them it's been in the fridge for 2 days, they're not going to use it. Hospitals are very careful about what they will use when it comes to breast milk being brought from home. And if there's anything that they feel is not according to the standard or rules, they won't use it. So I don't want you guys to ever waste milk because it's so hard to get that milk. We work so hard for it. So that's one of the things with colostrum. Make sure that you are collecting it and labeling it the right way. So that was a good question, Ramante. For anybody who's joining me, I'm Dr. Samantha, the maternity mentor, and I have actually answered all of your questions on the videos this week already, and I've answered some questions in the chat. Please, if anybody has any questions, please put them into the chat because as I told some people, I'm going to be getting off soon to get ready for a hurricane. One of the things that I'm going to tell you guys when you are getting ready for stuff like a big storm like I am and you have kids, the dollar store has great activities for small children. Make sure you have plenty of water, plenty of snacks. It's just those are the things that will make it go a lot easier. In addition to all the emergency supplies that everybody always hears about. We always get all that list of stuff for what we need. It's a good list. You should get everything on the list. But it never takes into account like small children and toddlers who you then have to figure out what to do with over, the next little bit of time. My producer put in a question into the chat, which is a very good one. Do hurricanes trigger labor? So hurricanes can actually trigger labor. So the pressure changes that happen in the atmosphere can actually cause women to go into labor. So again, I'm in South Florida. And one of the things that we will tell women to do when a hurricane is coming is we will tell women to go ahead and come to the hospital if they're like 36, 37 weeks or greater. So hospitals are not used as shelters. That's not appropriate. We do not do it. But one of the exceptions is pregnant women. And usually what will happen is the hospitals will actually have a room in like a room. I say a room, like a big room, like a conference room, or sometimes they'll put them in the cafeteria or something like that. A big, large area for women who are pregnant to actually be there with their partners in case they are to go into labor during that time, because you do not want pregnant women and their partners driving through hurricane force winds, especially at night when there might not be any power to get to a hospital because they are in labor. So yes, hurricanes can trigger labor due to their pressure changes. Does anybody else have any questions for me before I let you go? Remember, as if you guys have any questions and you're putting it in, remember, I'm also on Facebook and Instagram for additional content. Please, please, please like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator and allows me to be a part of the YouTube health platform. I really appreciate all of your support, and this is one of my favorite things to do, to come on every Monday at 9 p.m. Eastern Standard Time to answer your questions live. So, anybody else have any questions? I am going once. I am going twice. I'm going 3 times. I'm going to go get ready for a hurricane. Thank you so much for joining me. I'm Dr. Samantha, the maternity mentor. Bye for now. Bye, Ramonte. Thank you so much. Have a good one, guys. Bye.